and that is our allocation plans, and they're all new. These are detailed allocation plans. Today, we have additional details on the allocation plan. We will get a limited supply of vaccines at first, so our team of experts are still finalizing the plan to make sure that the vaccines are available to West Virginians, starting with those who are at the highest risk. We have 2 phases for allocation, and you should see them on the screen. Phase 1 includes those at the highest risk and those that are essential frontline workers fighting this pandemic. Phase 2 is the general population. Phase 1 is broken down into 4 subsections, A through D. As we receive doses of vaccine, we will prioritize distribution in this order. Phase 1 includes hospitals, long-term care facilities, and staff, and pharmacies. Phase 1B includes community infrastructure and emergency response, public health officials, and first responders. Phase 1C includes other healthcare workers like home health providers. Phase 1D includes teachers and education staff in higher education and K through 12 and other sectors for critical services for our state. Let me back up. Phase 1D includes teachers and education staff in higher education and K through 12 and other sectors for critical services for our state, and like utility workers and transportation workers. We are planning to offer vaccines to all individuals identified in 1A through 1D within the first 6 weeks based on the allocation of vaccines. As our allocation increases and distribution occurs, we will be able to move through the phases more quickly. In phase 2, which is the general population, we will place initial emphasis on the most vulnerable in the general population based on the guidance of CDC. Now, the other thing I've said, and if you'll look, go back up to that the last slide. If you'll look, the timetable to get to the general population, we think now is probably around March the 10th or March the 15th. That's what I thought before. That's what I reported to you before, and everybody said, oh no, it'll never happen, never happen, never happen. Well, I tell you, if you don't push hard enough, nothing will ever happen. You know, I hope and pray that will happen. We all know things are fluid. We all know things take probably longer than what we think, but that's what we're pushing for. Some vaccine reminders are just this. The COVID vaccine will protect us from this virus and save lives. There's no question. Clinical trials with tens of thousands of people have demonstrated that the vaccination is highly effective and safe. These vaccines will require 2 doses, and it is extremely important to receive both doses of this vaccine. You will not be able to cross-pollinate one or the other. You will not be able to take one vaccine from the Pfizer and go to Moderna and do the other. You have to stay Pfizer or Moderna. These numbers will change, and when they do, we will announce additional phases and additional groups that we will be receiving the vaccine. And again, until you and the people who live with us are vaccinated, our best defense goes back to wearing that mask and absolutely doing the social distancing.